In this video, I'll review information from Chapter 22 of Human Anatomy and Physiology, 11th edition. This chapter focuses on the respiratory system. In particular, we'll be looking at the control of breathing, in particular, control of breathing by the nervous system. So there are several factors influencing the rate and the depth of breathing. In order of importance, the most important is the partial pressure of carbon dioxide, so how much CO2 is in the blood. Second, and the second most important, would be the partial pressure of oxygen. How much oxygen is in the blood? This is sometimes counterintuitive. Most people think oxygen is the most important, but at least for the rate and depth of breathing, for the control of breathing, it's actually this CO2 that is the most important, even more important than the amount of oxygen. And then finally, we have pH, so protons are also going to play a role in regulating the rate of and depth of breathing. All three of these factors are being sensed by both central, meaning in the central nervous system, and peripheral chemoreceptors. There are two brainstem locations for the regulation of the control or the control of breathing. These are the respiratory control centers. You can see that one is found up here in the pons of the brainstem, and the other is found in the medulla oblongata, also in the brainstem. These are working together to help to regulate the rate and depth of breathing. The respiratory control centers shown here are going to set the rate and the rhythm of breathing. Normal is about 12 to 15 breaths per minute. And these centers are going to regulate breathing by exciting the inspiratory muscles. So, for instance, the phrenic nerve is the peripheral nerve that innervates the diaphragm. And this is going to be the nerve that contains the motor neurons that excite the diaphragm and cause the diaphragm to contract. The intercostal nerves innervate the external intercostal muscles and cause them to contract. These respiratory control centers in the brainstem are receiving input from peripheral chemoreceptors. So the partial pressure of carbon dioxide has the biggest influence on the respiratory control centers under normal conditions. And so under those normal conditions, you can follow this flow chart, and I'll just summarize it here on the right. As carbon dioxide increases in your blood, that carbon dioxide is going to get converted to bicarbonate, but also as carbon dioxide increases, you'll also see an increase in protons, so a decrease in pH. That increase in protons is going to stimulate central chemoreceptors. Those central chemoreceptors will then stimulate the respiratory center. And the respiratory center, as mentioned in the previous slide, is going to stimulate those inspiratory muscles. And this will increase breathing depth and breathing rate. So you'll breathe more. So increased CO2 leads to increased breathing. And that's shown here. Here's increased CO2, and at the bottom, we have increased ventilation. However, there are two ventilation disorders. So hyperventilation is when there's increased ventilation that exceeds the body's need to remove carbon dioxide. So the body goes too far. Not only do you decrease the carbon dioxide back to your set point, but it keeps going. You're breathing too much for your tissue's needs. And so what you'll end up seeing as a sign of hyperventilation is decreased blood carbon dioxide levels. This is going to cause vasoconstriction in the vessels of the brain, and it can cause cerebral ischemia. Because of that cerebral ischemia, so the lack of blood flow to the brain, you may start to feel dizzy and you may even faint. So that's usually the end point for hyperventilation. If you can't take care of it consciously, your body will take care of it by forcing you to faint. Apnea would be complete cessation of breathing. So breathing completely stops. That's called apnea. You may have heard of this in disorders that include sleep apnea. So in a lot of people, as they age or as they gain weight, they may see more incidents of sleep apnea, so breathing cessation during sleep. And this may cause this may be caused by abnormally low partial pressures of CO2 in the blood. So now, the partial pressure of oxygen normally has only a small effect on breathing. So the chemoreceptors for oxygen are located in the walls of the aorta as well as the walls of the carotid artery. So here we have the carotid body, here we have the aortic bodies, and when oxygen levels drop, that's going to stimulate the respiratory centers to increase ventilation. However, this requires a very large drop. So remember, once oxygen reaches your blood, it starts at about 100 millimeters of mercury, and so it needs to fall by almost half in order to stimulate that increased ventilation. So that's why we say that at normal conditions, that partial pressure of oxygen is only going to have a small effect on breathing. The carbon dioxide is going to have an effect much earlier than this. Decreased pH is also detected by these peripheral chemoreceptors. One reason for that is that the protons actually don't cross the blood-brain barrier, so they can't get to the central chemoreceptors. This decrease in pH is often caused by increased carbon dioxide, but it can also be caused by other metabolic reasons. So maybe ketoacidosis is one example. The response to acidification of the blood is increased respiration. And again, this is an attempt to increase the pH back to normal. So a little summary of those stimulants of breathing. Rising carbon dioxide levels are by far the most powerful respiratory stimulants under normal conditions. Only when arterial oxygen levels fall below 60 millimeters of mercury does that oxygen become a major respiratory stimulant, and it's going to act via those peripheral chemoreceptors. And finally, third, changes in arterial pH, typically from increasing carbon dioxide, but sometimes from other metabolic sources. That changing pH is going to act indirectly through peripheral chemoreceptors. So as you see acidification of the blood, you're going to see additional ventilation. And I'll leave you with a question. Under normal conditions, which factor has the largest impact on the rate and the depth of breathing?